Hi, what brings you in today?
Hi, I just haven't been really feeling that good. I've been very dizzy and it feels like my heart isn't beating right and it feels like it's in my throat and I just don't know what's causing it.
Okay, that sounds concerning, so I'm going to bring in the doctor and he's going to run some tests on you.
Okay.
Hello.
Hi.
So it says here that you've been experiencing chest pain along with dizziness?
Yes.
Okay, well, that does sound concerning, so we will order you an EKG just to be sure.
Sounds good.
Let's rewind.
So what is an EKG?
An EKG stands for electrocardiogram, that is used to record the heart's electrical activity and rhythm, so it involves putting electrodes on different parts of your chest and abdomen.
So how exactly does an EKG work?
Well, there are 5 different types of waves in a heart rhythm. There's the P wave, the Q wave, the R, S, and T. All of these waves represent the atrial and ventricular contractions of the heart.
In this diagram, it shows the cycle of contractions within the heart. In phase 1, the P wave represents the depolarization of the atrial contractile fibers, or the contractions of the atrium, which is the upper chambers of the heart. The depolarization is caused by the sodium ions entering the cell of the atrium and cause the cell to become positively charged, causing the heart to contract. The SA node of the heart sends an electrical signal, letting the heart know it has to contract. In phase 2, atrial systole begins. This is contraction, pushing the blood into the ventricles and putting pressure into the chamber. In phase 3, the QRS wave represents ventricular depolarization and repolarization of the atrium. This complex will always consist of the Q, R, and S wave and occur rapidly.
In phase 4, ventricular systole occurs. The ventricles contract shortly after the QRS complex appears and continues during the ST segment. In phase 5, repolarization of ventricle contractile fibers begins, producing the T wave. In phase 6, the final step, ventricular diastole occurs, relaxing the ventricles until another signal from the SA node begins the process again.
So how do we monitor these electrical signals on the patient? Well, there are 10 electrodes that we use in the process. Okay, so this is an EKG machine, and these are the 10 electrodes that we use to attach to the patient in order to measure their electrical signals. Okay, so this is how we would set up the 10 electrodes on the body when taking an EKG.
So looking at this, you can see that there are 10 electrodes, but there are not 10 leads. There are actually 12, and this is because certain electrodes are part of 2 pairs, and this provide 2 leads. So there are leads between the left leg and the right arm, and the right arm and left arm.
V1 is the first electrode to be placed on the patient, and it is placed in the 4th intercostal space on the right side of the sternum. V2 is placed on the opposite side of the sternum in the 4th intercostal space as well. V4 is placed in the 5th intercostal space of the ribs, mid-clavicular line, then V3 is placed directly in between V2 and V4. V5 will be placed at the same level as V4 on the anterior axillary line, and V6 will be placed in the same level as well on the mid-axillary line. There are 4 other electrodes placed on the body for the right arm, the left arm, the right leg, and the left leg. So from your EKG, it did suggest that you had a mild heart attack. So in her EKG, you can see that she had elevated ST wave segments, and that means she did have a mild heart attack. Okay, so I will prescribe some aspirin for the blood clotting and keep you overnight for observation.
Thank you.
You're welcome. Hi.
Hi.
So it says here that you've been experiencing chest pain along with dizziness?
Unfortunately.
Okay, so from your EKG, it did suggest that you had a mild heart attack.